What's up, everybody? Want to talk about sleep. It's a subject that most people don't discuss, but it's so important to our health. So I'm going to define what the difference between sleep insufficiency is and insomnia. So sleep insufficiency is essentially you are not getting enough either quality sleep or hours. Both count, quality and hours. Versus insomnia, which is you can't fall asleep if you're given the opportunity. I mean, you go lay down and you just can't sleep. It's your normal bedtime, whatever. And if that goes on for an extended period of time, we call that insomnia. Now, insufficiency just indicates that you're still able to get to sleep, but there's a problem with quality or quantity. So what is the best marker of whether we're getting enough sleep? It's basically your reported symptom of whether you feel refreshed when you get up or you don't. And that's the best way to deal with that. And it's the number one question we ask in family care about how people are sleeping, whether they feel refreshed or not. Now, what has the studies concluded about sleeping less than 7 hours? Less than 7 hours. Now, we're dealing with quantity here. We're not discussing quality, but generally if you don't have a sleep issue and you sleep less than 7 hours, most studies show loss of logical reasoning and math ability. Basically, you're not going to do good at complex tasks. If you're a child and you're going to school, you're not going to pay attention. You're going to be disruptive. And, spelling error here, but loss of ability to pay attention to complex tasks because imaging shows that our frontoparietal lobes that control reasoning and math and things like that, our ability for personality, decrease their attention. So that network that keeps us awake and active and thinking properly decreases if we get less than 7 hours of sleep. We know that depression and anxiety scores increase in patients that sleep less than 7 hours. There's an increase in workplace errors and motor vehicle accidents. Think about some of the studies say a third of us are sleep deprived and insufficient, and we're all out driving these 2-ton vehicles and ramming into each other, and you could almost say that a third of the accidents are probably related to sleep insufficiency, and we placed our complete trust in these other people to be around us to be aware and awake, yet a third of us are sleep insufficient in America. So the other things that it shows a link to is cardiac disease. So atherosclerosis, which leads to MI and stroke. We know that there's an increased rate of hypertension, so high blood pressure. Inflammation markers of the blood increase when we don't sleep. We see higher rates of obesity and illness, so loss of immune function are a huge deal with that. So those are just some of the things that the studies show. So I want to talk about what the recommendations are from the current recommendations for sleep. So you have newborn all the way to older adult here. We have most people watching this kind of thing are going to be in this age range right here, young adult to adult. Dark blue is recommended. Light blue may be appropriate. Not recommended is all this yellow. So let's take a look at adults and young adults. 7 to 9 hours is the recommended sleep. It may be okay to be up in that 10-hour zone, and may be okay for some people to get 6 hours, although most studies show that this is not realistic. So really we should be shooting for 7 to 9 hours of quantity. Now we're not talking about quality. If we're being woken up regularly, either from sleep apnea or other things through the night, our quantity may need to go up in order to allow the brain to hit REM sleep, where the brain heals and some of the body things heal. Now, some of the studies show that if we are deprived and then given the opportunity, our percentage of REM sleep will increase so that the body can try to catch up. And there's a lot of talk about whether we can actually catch up or not, but that's for another discussion. So this is actually a diagnosis a medical provider can give, insufficient sleep syndrome. And so this is the criteria A through F to be met before you can give that diagnosis to somebody. And usually we ask people to provide sleep logs because this helps us understand what their maybe over 2 weeks or a month may occur. So if we just quickly go through the A through F criteria, daily periods of irrepressible need to sleep or daytime lapses. They're drowsy, they can nap, things like that. They just are so tired. We need to look at a sleep log, so we may actually have to ask for that. But essentially, are they sleeping less than the recommended 7 to 9 hours for adults? And is this going on for a substantial amount of time. So usually that's the 3-month mark where we start to get into chronic issues with sleep. And is there insomnia? We need to verify that. Are they just not able to fall asleep versus are we just insufficiently being able to sleep? When you take away alarm clocks or other people waking them up, will they sleep longer? Essentially, like if you're Saturday and Sunday, you sleep until noon and you normally get up at 8 o'clock by an alarm clock, that may mean you actually fulfill insufficient sleep syndrome criteria. Here's another one. Extension of total sleep time results in the resolution of the symptoms. So once you've slept in for Saturday and Sunday, do you feel refreshed when you wake up? Is that curing that insufficient sleep that you're getting? And then is this not better explained by a circadian rhythm sleep-wake disorder, especially like people that work nights or some other medication on board that could be disrupting this, etc. So let's move on here. Okay, this is a study I pulled out. Now this was published in the American Journal of Respiratory Care in 1996, so it's older, but it's even worse today more than likely if they were to go back and look at that. But the reason I wanted to bring this out is there's a lot of undiagnosed sleep apnea where you basically stop breathing for a period of time and the body dumps a bunch of adrenaline to try to wake you up, and you may not even wake up and know it. But what they did to verify what was happening with people is they took 16 normal people and basically over 2 nights woke them with sound impulses in every 2 minutes to create that sleep apnea type problem. So what they found is, if we look here, that 1 night of sleep fragmentation makes normal subjects sleepier during the day, impairs the subjective assessment of mood. Basically, they feel more depressed or anxious, and they lost ability to pay attention. There was some testing that they did here. I don't know these tests per se, but they had created some tests to check attention and cognitive ability. So what can we do? Well, these are the best recommendations if we have sleep insufficiency syndrome, not insomnia. Insomnia is a true medical diagnosis that you may need help with from a medical person. But the recommendations to improve sleep are reducing screen time before bed 2 hours. And if you need light, less than 15 watts of light, that's a very low amount of light. You want to block the blue if possible, which most of our devices, TVs and screens, give out some blue light because it affects this little pineal gland in the brain that secretes melatonin to help us fall asleep. You cannot give melatonin on the same basis that your body produces it. That's why it's called a supplement. The best thing is to help your body produce it by the avoidance of blue light, if possible, reducing the screen time 2 hours before bed. And if we need light, it's less than 15 watts. It's a very low amount of light, 2 hours leading up to bed. We need to establish a bedtime routine, meaning we go to bed and wake up the same time every day. We have a routine before we go to bed to wind down, where we're reducing worry and stress so that we can fall asleep quickly and not be woken up. The other thing is, people that exercise in studies have been shown to sleep better, have higher quality, less wake-ups, and have better routines. Now, obviously, don't exercise before bed because you're going to get the adrenal dump, and that's a problem. You won't be able to fall asleep. Cool rooms have been shown to be better than warm rooms, and blocking out light and noise is super important in all studies that have shown that. The other thing that you can do, especially if you wake up before the sun, is to expose your eyes to light. And they do sell light that it mimics the sun's natural light, but if you can, opening blinds, letting light in, or a synthetic device to open up some of those pathways of alertness through the circadian rhythm. We do follow the sun like every other life on Earth. The other thing is avoid caffeine. If you smoke, don't smoke before bed. That caffeine's a stimulant, and so is nicotine. And then if you're doing all these things and you're still feeling unrefreshed, you really should consider sleep testing. Maybe you have sleep apnea or something going on that needs to actually be treated. Thank you very much.